Good evening, everyone. I'm here with my mother. She's been a patient of Dr. Hill's for about 7 years. She's a chronic cancer patient. She's had breast cancer 3 times. She was going to Kaiser Permanente. They did nothing to her but give her medicine. She's worked 25 years in child care and taken care of special needs children. Her insurance gives her $2,000 a year for medication. That much. She was on tamoxifen for 7 years. It ruptured all of her bone density. So she has all these seizures. She falls down all the time. If it's not hard enough watching your loved ones in pain and being in chronic pain and chronic illness, it's hard enough when you have to wonder about how you're going to make it to pay their bills to get to the doctors or get them the medicine that they need. When we started coming to see Dr. Hill, he was a blessing in disguise. It's times I used to sit on the side of the bed and pray and ask God to take the pain away from her and give it to me, because she was bedridden. She couldn't get up. Her tamoxifen was, I think it was $800 a prescription. One of those wiped her out for the year. If it wasn't for Dr. Hill, she'd be bedridden now. And I'm terrified because I don't know what's going to happen to my mother if they take his license away. And that's a terrible feeling. Not only do we have control of the illness that she has, but now who's she going to see? It's hard. The economy's hard. He doesn't even ask us to pay sometimes. Bill me, throw it in the mail when you get a chance. If that's not an angel, I don't know what is. So, Dr. Hill, we're here to fight for you.
Hello, everyone. My name is Chris Andrews, and I have 2 jobs. One of them is I'm an assistant professor for anatomy and neurology over at Touro University there. Anatomy, I guess, speak for neurology. So I have a little bit of an idea about what goes on with the body, and it is amazing to me that the other doctors I have seen along the way have absolutely no idea what's going on, and they're pointing to, recently, a doctor I saw for another reason, pointed to an area and called it this muscle, and it's like, no, it's this muscle, you know? So and Dickie has been right on top of the anatomy and has taken really excellent care of me. There have been times on Sunday afternoons. There have been times towards the evening, early on weekends, staying late for me or waiting through lunch, staying late for lunch, that he's been willing to take care of me and, again, has been excellent, outstanding care. I have health insurance, but I choose to go to Dickie. I am standing up here straight right now, about the straightest I've been in the last 6-8 weeks, largely due to Dr. Hill. I've been bent over almost double with back pain, spine fractures, and there's a whole list of things. And Dr. Hill's been amazing in working with different medications. We've been trying this, we've been trying that, trying to get to the right combination that is going to help me the most. We have, and now I'm standing up. I can actually move around, and I'm real thankful for that.
Hi, I'm Ken Buskey. I'm standing up here straight talking to you because Dickie adjusted my back this morning. Otherwise, I'd be kind of hunched over, but more about that later. I arrived in Benicia 25 years ago, decided I'd better get some medical coverage, applied to Kaiser, and they rejected me because I'd had 1 kidney stone. Well, I haven't had many since, but that's how it works with Kaiser. I thought I was unlucky with that, but it turned out I was really lucky. I found Dickie Hill instead, and he's turned out to be the best doctor ever. He's been a good friend. His whole family's been a wonderful friend to me. and it's just been wonderful. And I just feel, well, I do forensic work, and I get too wrapped up in these cases, and then my back gets tight, and I get all hunched over, and I can't straighten it out or do anything myself, and drugs don't do it, but Dickie does the manipulation, and here I am, good as new again. So it's just been wonderful this whole 25 years working with Dickie and him fixing me up, and I'm so grateful. I want to say thank you. And I feel like these, where I do the forensics, I feel like these charges are just kind of bogus. They're older than outdated prescriptions. This medical board, what they're doing would never stand up in a real court of law. It only works because they're acting in administrative law people, not real courts. So they're running a different system. And what they're doing is driving up our costs, and they're also tending to scare other physicians. And so for those reasons, it's really important that everybody do what they can to either write to, on the website, you can either write to Jerry Brown's office, you can write to the osteopathic board, or you can, of course, send the certified letter.
Hi, my name is Barry Griebel. I'm 66 years old, and I'm only able to stand here before you today because of Dr. Hill. A year and a half ago, I was hit on the freeway and found myself upside down with 4,000 pounds of van sitting on top of me. And the result is I was a basket case, psychologically, emotionally, and physically. And Dr. Hill put me back together again to the point where my medication right now is aspirin. And you see that I'm a functional person. So I have been told that the medical board is honorable. I have been told that Jerry Brown is honorable. I have been told that our other elected officials are honorable, and I choose to believe that. So I have a request for the honorable medical board, for the honorable Jerry Brown, and for our honorable elected officials. Leave this man alone and let him do what he knows how to do best, which is practice medicine. He is a great doctor and a great human being. I beg you, leave him alone. Thank you.
Hi, I'm Neil Hamilton. I'm a chiropractor in town. I've had the privilege of practicing actually in the same office with Dickie for 12 years now. There's been many, many times in my office when I'm in with a patient that they'll tell me their horror stories about their conditions and trying to get medication for their conditions or the right medication for the conditions, or have a question for me from a medical standpoint that I can't answer. And, you know, all I would do is step out in the hall, and I would catch him walking down the hall, and I would ask him, and he'd always answer. He'd always give me an answer. He'd always step inside and talk to my patients, free of charge, no charge at all. I'm a Kaiser. My wife has Kaiser insurance. So obviously I should go to Kaiser. I don't. I go see Dr. Hill because I know I'm going to get good care, the best of care, the right care. I trust him. I know he's smart as can be, especially, I mean, from a medical standpoint, from a history standpoint. He's not a very good golfer. He thinks he is, but he's not. But I think I'm the only one in this room that's ever seen him make a hole-in-one. Is that right? Yeah. You only made one, right? Yeah. So, but, you know, it's these, as a chiropractor, you know, the chiropractic profession's over 100 years old. Dr. Hill does manipulation. That's what I do. These are the same doctors that have called us killers all these years, have just put down chiropractic. And I know from a chiropractic, from a natural healing standpoint, what manipulation does. And he's a great manipulator. That's most of his practice, or as much of his practice is natural healing manipulation. And these are the same type people that have called us killers for years. And we've survived that, and I think you're going to survive this too. I know that. I mean, you got the best doctor in town, and he's my doctor, so I appreciate it.